Good morning, guys. I hope we're all sparkly. Just a quick video on my break. We're going to talk about, can you be too old to start testosterone replacement therapy? Is there an age that you should stop taking testosterone? Or can you be too young? Well, disappointingly, we do have patients who are 18 starting therapy. They've struggled for years. But we'll save that for another video because we're going to concentrate on, can you be too old? Well, we have a number of patients who are in their 70s and somebody who's 80 just started therapy the other day. How amazing is that? What do they want? Well, if you listen to the media, they're grumpy old men that just want a bit of nookie. They actually want a better quality of life. And what's wrong with that? They want more energy. They want less brain fog. Yeah, they want a higher libido. They want to attain an erection. They want all the things that everybody wants. Normality. Not average, normality. They want to be better versions of themselves. So we know about testosterone's role. It's an anabolic hormone necessary for growth and repair. It's the fundamental hormone. Testosterone replacement therapy is the catalyst for change to allow you to be the person you want to be. So yesterday I saw two guys in their 70s, 170 and 175. The 75-year-old came for his annual review and he feels great. He's got what he wanted out of testosterone replacement therapy, understanding that he needs to put the effort in to achieve the reward. He remarked, "I don't ache anymore and I'm playing my guitar." The hobbies that you have shouldn't be limited by your physicality and your brain starting to struggle because you have a deficiency of a hormone that's quite easily replaced. The 70-year-old, he's at week 11 and we're dialing him in. He had literally no testosterone, and the NHS were palming him off with the usual cocktail of antidepressants and Viagra. Why don't we address causation? You're too old for that. You're not too old for that. We should always be looking to address causation, not treat symptoms with a cure which doesn't cure anything, because it doesn't address the fundamentals of why you have a problem. So if you have low libido, fundamentally your hormones are necessary for a libido, your brain's necessary, your stress is going to negatively impact your libido, the list goes on. So you can't have a one-size-fits-all approach. You need to address everything, but you need to start at the fundamentals. And as we've said before, there's a chronicity to hormones, an acuteness to the autonomic nervous system, and a reactiveness to the brain. And everything affects everything. Hormones are dependent. Whether that relationship be direct or indirect, we must look to adopt a holistic approach to health. So these old guys, is there anything we do differently? Well, no, not really. We microdose testosterone replacement therapy. We give an appropriate dose of testosterone and HCG to optimize their levels for long-term physical and psychological well-being. Do they need a lower dose? No, because healthy hormones are healthy hormones. And we closely monitor these guys. We check their hematocrit, their lipid profile, their blood pressure. We ask them how they're getting on. How's their sleep? How are their energy levels? Are they getting what they want out of therapy, understanding that effort equals reward? Now, they're not 18 anymore. They're no longer invincible. You weren't invincible at 18, but you thought you were. You were given thousands of chances to do the right thing, and because you got away with negative behaviors, you continued to engage in negative behaviors, and ultimately we all pay the price for our misdoings. It is what it is. So yeah, we safely and effectively titrate their dose according to effect to get them where they need to be. Now, we know that testosterone levels drop with age, but that confers no biological advantage. Now, men do become less fertile, and I do wonder whether that's actually one of the reasons why you get a rise in shbg as you advance age. But we're not seeing that in our society, are we? We're in our society, because everybody's unhealthy, everybody has a degree of metabolic syndrome, type 2 diabetes, hypothyroidism. We see this drop in shbg, but we are supposed to think that we raise shbg to lower free testosterone. Now, if you can postulate an idea as to why that might happen as a result of not needing to procreate, or the fact that shbg bound testosterone does still go into the cell for its primary role, growth and repair, and we know it goes up in stress states, it gets a little bit complicated, doesn't it? But the fundamentals are optimizing levels for long-term physical and psychological well-being. What else is there to say? Do we do anything differently with the older guys as we do with the younger guys? No. It's the same. Healthy hormone levels are healthy hormone levels. What should you be doing as an older guy on testosterone replacement therapy? Should you be banging it out in the gym? Well, as I said to this guy yesterday, he said, I'm only training twice a week. I said, that's fine. You don't have to be banging it out in the gym. What you do have to be doing is protecting your muscles. So we know testosterone is an anabolic hormone. It increases the nitrogen concentration within the cell, and that promotes protein synthesis and prevents protein degradation. What we're really trying to do is prevent sarcopenia, so muscle loss. Our muscles serve an obvious, important role. Not only do they transport us around, they also protect our organs. So we want to be healthy, we want to be physically active, because as I've said before, we're physical beings in a world full of psychological stress. Be physical. How often? Every day. It doesn't have to be in the gym. I train 6-7 days a week. I am the old guy in the gym now. How disappointing is that? But I tell you what, I work a lot harder than the young guys. I am putting the work in. I've always put the work in. These guys now, they're sat on their phones. They're having their 2-minute break because that's what the data says. We're all unique. We're not special. The data's flawed. The data does not transcend into applying that methodology to everybody, and it will obviously work because we're all the same. We're not all the same. I go hard and heavy. I rest just as long enough so that I can go hard and heavy again. When I was younger, I subscribed to the Arnold Schwarzenegger methodology, 12-10-8-6-6, but also the Dorian Yates, shout out to Dorian, blood and guts. Put the effort in. When I leave the gym, I'm cream crackered. What's happened to my training? Well, I've adapted. Not only because I'm getting a bit old and my joints aren't quite like they used to be. Yes, Father Time will catch up with you eventually, even with healthy testosterone levels, because you are using your body how it should be used, but there is a finite capacity and we will eventually wither away. Burnout, not fade away. So my training's been adapted. I'm doing lighter, higher reps, but I'm supersetting, I'm drop setting, but I'm not destroying myself and my body because I am no longer invincible. As I said before, I wasn't invincible before, but I thought I was. And what have I done? Oh, I've knackered my body. But I'm overcoming, I'm adapting. I am trying to be what? I am trying to be the best version of myself. And that's what we should all be aspiring to do. Whether you're 18, you're 30, 40, 50, 80, there's no reason not to want to be a better version of yourself. And if testosterone is the foundation and TRT is the catalyst, Utilize that, put the work in, and you will see the reward. There's no need to stop testosterone replacement therapy ever based on age, because as I've said before, why would you? Why would you not want healthy hormone levels for physical and psychological well-being? It makes no sense at all. Right, nothing more to say. Got to get back to work apart from you know what. Earn your reward.